Hi, this is Dr. Brad. We're back again with Brian Sachetta on his Get Out of Your Head concept. This is a mental health concept that is a lifestyle and a brand name that he's come up with. This is also the name of the book that he's produced. And he's really a dynamic thinker. He's really got his head on straight. He's really good at dialoguing. And we might seem like we get off in a bunch of rabbit trails, but these are dynamic, important issues that commonly aren't brought up in mental health. And so this is really good one to plug into. And we're going to jump back in and continue this for session 2 right here. And if you look at the ultra-processed food, RFK Jr. has made this public. 72% of the crops in America are subsidized to, with big ag and all that, tax incentives and everything. Of all the foods that are grown on the subsidies, those are the most toxic forms of foods we have. 95% of the hard wheat crop is sprayed with Roundup 2 days to 3 weeks before its harvest. No time for the plant to clear all that stuff. Corn is full of atrazine, is 10 times worse than Roundup. It destroys the ability to detox. It destroys the ability for the microbes in the gut to actually be able to digest foods and break them down and all that. Same thing happens in the soil. It's the microbes that break all the nutrients down and deliver it to the roots of plants. It's the microbes in our gut that break all the food down into absorbable forms, and they deliver that to the gut wall. So you paralyze all that stuff and destroy the detox pathways as far as that goes with all these herbicides and pesticides with no nutrients. And what do you have?
It's not good.
Yeah, it's a perfect storm for things like what you're talking about. It's just you set the stage.
Yeah.
And it's we don't know, like if you looked at any research, how prevalent was anxiety before the 1950s?
So the rates have gone up a lot, and this is where I want to open up a can of worms and talk for a long time, because I think any thread that you pull on could be one that's worth investigating. As in, the food would be, really important. The fact that, one lens that I love that I write about and I talk about all the time is evolutionary psychology and the notion of evolutionary mismatch, which is basically, right, our brains and our bodies evolved in a certain evolutionary environment, which was basically the savannas of Africa. And so they are pretty much tailor-made for that environment, as in they thrive best or pretty darn well in that environment. And now we live in very, very different environments from that one that we are suited for. And so when we ask about anxiety or any other disorder, disease, really, what I think about is the fact that, like, we are fish out of water. We are not designed for the environment that we find ourselves in. And I mean that on every level, right? I mean that on the fact that we don't form very many close relationships that we probably need to or we used to. We used to live in small tribes, and now our tribes are like 500 friends on Facebook that we don't actually talk to. We just, click a button and say, I like their post. We don't go outside nearly as often as we used to. We don't move around as often as we used to. Most of us don't have a lot of meaning and purpose in our lives. We kind of just go by to, try to get by every day and pay the bills and that sort of thing. And we also, like I said earlier, we eat garbage, so you combine all of those things and many other concepts or topics as well. I'm like, add all those together, and that's the disease state that we find ourselves in. And I know that's a loaded term, but I mean that on every sense of the word.
Yeah, anybody that's been involved in health knows that. Here's one of the biggest issues as far as that goes. You're talking about medical doctors. When I was in grad school, that's 40 plus years ago, there was only 2 medical colleges in in North America that had nutrition as an elective. That they don't teach it there, so that's not the place to go for knowledge. The ones who go through their nutritional programs to get like a dietitian or something like that, very, very close-knit group that's got a specific approach to deal with things. Guess who are the funders of their continuing education?
It's got to be somebody involved with the food industry or the medical industry for sure.
Pepsi Cola is one of the biggest.
Yeah.
So what kind of nutrition comes out of that? And they're promoting products. Years ago, the most dangerous place to eat in North America was hospital cafeteria. The most unhealthy food, the most dangerous place to eat to get you the sickest, hospital cafeteria. That hasn't changed. That's research. That's not my opinion. That's research. Which, by the way, the research is published out there in all the world journals, the double-blind studies and all that. 40% of the best articles in the best journals have what's called spin on them. The results are not supported by what the study said. It's suggested as 75% of the time in America, and 75% of the time it's overt fraud, not a mistake. So you look at trying to find answers, it's like you really got to wade through a lot and have this deep, deep, deep understanding to get any truth out of it at all.
Yeah, it's terrifying, and I consume that information. I do my own digging. I'll tell you, at this age, I have become a very cynical man. You see those things, and you're like, everything's co-opted, everything's bought and sold, your health is bought and sold. And what I often come back to is thinking about the incentives, the perverse incentives of all these systems, right? It's not necessarily, and I'm going to give probably even more credit than might be due. There are no evil people out there. There are not people sitting in a boardroom, and I, like I said, more credit than is due here. There's not people sitting in a boardroom say, kill those people, make those people diseased, that sort of thing. The issue is that you look at the incentive structure and you say, okay, you've got these companies. What's their mission statement, or what is the North Star for them? The North Star is create shareholder value. And so when they say create shareholder value, and they have to say, well, we could run this study and we could just let the results speak for themselves. And if they don't, if those results aren't in our favor, we just live with that. Or we create some shell company over here and we feed it some money and we try to make it look like we're not affiliated with that company. And then, oh, look at that. We ran a study that said that sugar in, soda has nothing to do with poor health outcomes. That's amazing. And look at that. People are now going to buy more of our products and our stock is going to go up. And then we're going to be able to deliver more money to our shareholders. Isn't that amazing? And you know what the real sad thing about all of this is? Every single one of us, well, let's say 70 to 8, I don't know. There's a high percentage of us. We all have 401ks, some sort of retirement plan. And in that retirement plan is something like an S&P 500, some sort of broad market index. And you know what's inside of those indices is all these companies. And so we are part of the problem.
Yeah, it's amazing. We had for short time holdings in BlackRock. We didn't want to do that, but the financial advisor is saying the best company. But you look at what they represent and what they do all over the world. Ethically, it's so far out of our value system. I said, yank it out. We can't live with this. I don't care how good they are. Ethically, we cannot be a part of this. And so you're doing something else. But it's an interesting thing kicking things like this around. Because oftentimes we get in conversations that people don't expect. I don't know where they're going to go. And I think those are some of the best conversations we can really have is when people have some thinking minds that can throw stuff out, and it's not throwing mud in somebody's face, it's throwing something out. What about if we look at it from this perspective, or how do we throw this in, and how does this start to work when we start adding these other pieces that everybody wants to push away? Because the therapy is what drives the research and the market. because that's where the profit is. So nobody wants to find what root causes are. Looking at chronic illness was something I've studied for outside of the institutions for 4 decades. Guess how much they teach that in any of the institutions to graduate a quote doctor?
I'm going to assume it's 0 just
You're
because
absolutely right.
those are the conditions we struggle with most, and those are the conditions, like, on a personal basis, right? Each of us struggles with some sort of chronic health condition, and probably ends up dying from a chronic health condition. And yet, if you think about it from a broad level, like, we have not made any progress on heart disease, or very little, those kinds of conditions.
Right, because they only do the quote research on the quote cure, which is where somebody's going to profit from. They've no benefit in studying causation.
And that brings me back to my little ramble a minute ago, which was basically, right, the incentive chain. If you look at, okay, let's just say, let's keep other people out of it. I will do that for a moment. Let's say I go and start a business, and then I say, okay, I'm selling all this product and this is great, and I said I was gonna cure some disease or whatever it is, and people are taking the medication or product that I built in or created and distributed, but they're not necessarily getting 100% better. And then I'm sitting with my board members or whatever, and somebody says, hey, hypothetically, we have a new version of the product that we're creating, and it's going to fix every single problem that our customers have. Unless that product could be sold for an exorbitant amount of money, millions of dollars or whatever, we wouldn't want to sell it because we'd put ourselves out of business. Right.
Well, that's one of the big caveats as to why they don't allow wellness care as far as insurance reimbursement. It bankrupt the system to get people healthy. You got to do it a different way. And the measuring rod for someone who's really doing a good job clinically, I don't know if you know this, but the research proves out that only 20 to 25% of what doctors do, and this is for medical doctors, but it's the same across the board for every kind of doctor out there, only 20 to 25% of what they do has any clinical benefit whatsoever. Try and live with that. 75% of the people that walk inside of into any clinic for help has a chronic illness disease, and they're not trained on how to do it. No doctor school trains that. I did somebody asked me to do a segment on a summit for the education, and I was blown away. But there's no doctor school that teaches chronic illness. So, and people realize they're only going to be able to help 20 to 25% of the people that walk into their office or clinic, their interaction of all the doctor stuff. Could you live with that, though?
I don't think I could. I guess, I look at it a few ways. I look at it, first and foremost, I say individual doctors, individual nurses, physicians, assistants. These are all wonderful people who work really hard, who take a lot of schooling. They care a lot about people's lives, and that's amazing. I think the issue is that it's kind of the issue is at a larger level, right? It's on the pharmaceutical level. It's on the fact that the system is not a healthcare system; it's a sick care system, right? So if we really wanted to get people better, we'd be like, hey, maybe eat some vegetables, think about that. So that makes it challenging. And then the piece, right, where I don't have the numbers in front of me, but you look at some of these pharmaceutical companies and the amount of money that they make off of some of these drugs, knowing full well that, hey, maybe we don't have, the quote unquote cure yet, but also knowing that people are going to start taking these drugs, never totally cure the problem and be on the drug for the rest of their lives, and also have a lot of side effects come with it. There's a lot of money that gets, created and generated in that process. And that goes back to the sort of perverse incentives piece, right? Which is, sure, in a perfect world, we could say, look, we don't have the cure, so this is the best thing we got, and we're doing the best that we can. We hope that, this product helps you in some capacity. That's all well and good. But we know that based on the way the incentives are aligned, there's always going to be that wiggle room to say, is this, is it possible that this company might have a better version of the product? Is it possible that they could do things in a different way and cannibalize their own sales, but help people in a better fashion? And, I'd say obviously the pharmaceutical companies would argue one way and we might argue a different way, and we're never going to see eye to eye on that. But how I look at this for myself, right, is like in the mental health industry, I know that people who come to me, people who work with me, people who read my content, I know that, I'm not going to be the one who solves mental health for everybody on earth. I do the best that I can. I try to deliver value, and I try to make sure that people walk away from, my interactions or my books or whatever it is with content and information that they can apply in their own lives that's going to be helpful. And I willingly say, again, knowing full well that I'm never going to solve the problem of mental health on earth, I willingly say that if I could somehow snap my fingers and be like, I'm out of a job because everybody is mentally healthy and there's no reason for me to write any content in the mental health space anymore, I'd be totally fine with that. I would celebrate that, and I would love that, I think it's just, it's unfortunately, it's not quite the same way with some of these other conditions that we're talking about.
Ethically, if you are bettering people's lives, you can justify it. But getting them addicted to pacification, that's essentially how the whole industry is run, healthcare. Pacification, it's not dealing with causation. They have no concept of that, no way to deal with it because they have no education in it. And it's amazing. JAMA, Journal of American Medical Association, put an article out, I think, in 2006, where it said they have not changed medical education in over 100 years. And all their graduates are completely inadequately trained to deal with 75% of the conditions that come into their presence, which is chronic illness. Now, they admitted that back in 2006. The rest of the professions are exactly the same, and it hasn't changed. So you're talking pretty close to 130 years. It hasn't changed. And that's really, really scary, is that the incentives are wrong. And we got to get outside of that incentives to find some semblance of truth. And there are people who have these inquisitive minds that are very innovative in what they do. The system tries to destroy those people because they're threatening the goose, the golden egg kisser. They're just threatening the whole thing. And it's sad that you look at history, anybody that's innovative that really is successful, they destroy it.
Yep. And I try, like, I think you can probably tell by the way that I talk and I think about these arguments. I try to pick these things apart and be rational and kind of think them through and all that, right? And one thing that I think about is, this is really not meant to sound, rebellious or anything like that, but those that are in power, those that have authority, money, that sort of thing, they want to hold on to it, right? And so I will not name names, but I can give an example where, I was dealing with a business issue, right? Where I had a specific, I have a trademark on my brand. And so I was dealing with a company that was violating my mark. And I had a lawyer reach out to this company that was, violating the mark. And they come back to you and they don't say, hey, we're sorry, we violated the mark, we'll take care of it, that's our bad, whatever, right? They come back and they say, if you don't change, we're going to destroy you, right? And I don't necessarily look at that as, hey, these are bad people, these are unethical people. I look at it as, and I'm not trying to give them too much benefit of the doubt. I'm just saying that when you have the power, when you have the authority, when you are the top dog, you don't want to give that up, right? If I was in that position, I'd be like, oh, you small fry, like, shoo, get out of here, right? So it is something, a little bit of the human condition or the human dynamic of, we don't want to give that up. And when something comes along that threatens that, we want to squash it as quickly as we can, right? That's kind of how the nervous system works in general. When we detect that threat, we say fight or flight, get this thing out of here, you know? So there is a little bit of that going on. The other thing that I would say is, from my own perspective, I definitely give credit to the medical industry. Like, it is incredible at life-saving medicine, right? If you got into a car crash and you need to repair your body, if you broke your leg, if you're bleeding everywhere, you know, stitches and transplants and healing broken bones and all that, it is so amazing at that. And we need to give credit where credit's due on that. The challenge
acute
is
care. And that's the caveat. That's where they shine, acute care.
Absolutely. The problem is that, like, we live in a relatively safe world, not fully safe, but relatively safe world. And so what ends up happening is most of the issues that, you know, the majority of us deal with become those chronic conditions. And so it's like, hey, yeah, when I need you for a broken leg, I'll call you. But if I call you for, you know, being stressed out, having high blood pressure, whatever it is, if I call you, you know, based on what I'm hearing, I don't think the solutions are all that great. And based on what I've read and the conversations that I've had, both with folks like yourself and other people, is I think that's sadly how it's set up, right? Is it's acute care. We almost need to stop pretending that it's anything but that.
That's well said. That's really well said, because you've got to find the odd ones. I've told people for a long time, 3 questions you need to ask a clinician to get an answer before you consider working with them. First, what percentage of people that have what you think I have can you get well again? First and foremost. Second one, how long does that take? Third is, what's that cause? I've worked with people all over the globe, and I'm told over and over and over again, I'm the only one who ever asks the question and who can ever answer it. That should not be. I'm not that far outside of genius world or whatever you want to call it. It's a character issue. It's an honesty issue. It's an integrity issue. If I don't know what an answer is, I'll tell people I don't know. But for a lot of things people come, I got a pretty long history, and I know what to expect, and I'm pretty doggone close. This is Dr. Brad cutting in one more time. We're going to cut this one short right here and continue this in the next session. So you're not going to want to miss this. It's just, this conversation just keeps getting better and better and better.